Sir, please begin.
Good afternoon to everyone. Today, I'll be speaking on physiological and anatomical changes in the skin of the elderly. At the outset, I would like to thank Dr. Geetika Madam for giving me this opportunity to present this talk in front of you. Also, I would like to thank Dr. Gosai sir, the academic director, for his perseverance and keeping us all uh, uh, updated with the knowledge. And also like to thank Dr. Dhruv from Department of Psychiatry for his perseverance and regarding this CME. Today I present this topic. The rationale for choosing this topic is that this topic will interest a wide variety of specialties, including anatomy, physiology, biochemistry, general medicine, gynecology, pathology, etc. So it will involve a wide range of specialties. So different doctors from different specialties will have some interest in this topic. And also the undergraduate students, many MCQs will be asked from this topic in the NEET exam. So it is very important for them as well. So we'll start with the topic. So as I said, the topic is on physiological and anatomical changes in the skin of the elderly. A slide. Just a second, I'm trying to change the slide. Okay. Okay, so biologists define aging as a physiological process associated with morphological and functional changes in cellular and extracellular components aggravated by injury. So that is the basic definition of skin aging. So the question is, how do we age? So aging occurs through various processes. So we'll discuss the etiopathogenesis of aging. The first theory behind aging is the cross-linking theory. Based on this theory, it is based that the proteins, DNA and structural molecules develop inappropriate cross links to one another, which ultimately increase with age. And because of this, the aging process advances. So this is the first theory behind aging, that is the cross-link theory. The second theory, that is the telomere shortening theory. The ends of the chromosomes are basically known as telomeres. It is thought that as cells divide, the telomeres become shorter and shorter until they are gone. So the chromosome dies off and the aging process starts. So this is the second theory behind the skin aging, that is the telomere shortening theory. And the third theory behind the skin aging is the free radical theory. The free radicals, they develop inappropriate cross link of proteins and cause damage to the mitochondria, which ultimately leads to death of the cells, and the aging process ultimately starts. So this is the most widely proclaimed theory of aging, that is the free radical theory of aging. And the last cause of aging, that is described as the stem cell theory of aging. So the stem cells are basically the progenital cells from which the actual cells, they start to develop. So DNA damage to the stem cells can lead to two things. It can lead to mutation, in which case it can lead to neoplastic transformation, or it can lead to senescence and apoptosis, which leads to loss of structural chromosomes, which ultimately lead to degenerative dysfunction, both of which can lead to skin aging. So either because of mutation or due to apoptosis, the skin aging occurs. Now we'll describe the classification of skin aging. So the skin aging is caused by two main factors, that is the intrinsic aging and extrinsic aging. Intrinsic aging occurs because of anatomical variation, variation in ethnicity and hormonal changes, whereas extrinsic aging occurs because of sun exposure, lifestyle influences, smoking and pollution. So we'll be discussing each one of them in detail. First is the intrinsic aging. Intrinsic aging is the slow, irreversible degeneration of tissues that affects almost all organs of the body. It is also known as chronological aging. So what are the factors behind intrinsic aging? So it has been found that ethnicity is one of the important factors which determines aging. The African Americans have an increased level of lipid in their body, because of which they have increased resistance to skin aging. So they tend to age at a later date. The second theory behind the intrinsic agent is the anatomical variation. So it is hypothesized that areas with high blood flow, for example, the lips, the fingers, the nasal tips, the forehead, have more blood supply. And the blood supply also reduces drastically with age. So these tend to age faster as compared to other parts of the body. And the third important factor is hormonal changes, especially in women. The estrogen and progesterone levels, they fall after menopause, because of which the vaginal epithelium atrophies, the cervicovaginal secretions become sparse, the vaginal pH rises, atrophic vaginitis becomes more common, and collagen and water content decreases. Also, there is poor wound healing associated with aging. So these are some of the hormonal causes of aging. Now, we'll be discussing certain extrinsic factors which determine aging. These extrinsic aging is more important because this is preventable aging. And these are certain factors which we can prevent, or by which we can further reduce the process of aging. So the first and foremost important factor behind extrinsic aging is sun exposure. So exposure in the form of ultraviolet rays leads to release of TNF alpha and interleukin 1. Interleukin 1, which further activates nuclear transcription factor activating protein 1, NFAP1, which further activates MMP1, that is matrix metalloproteinase 1, which ultimately leads to collagen degradation. So UV exposure is one of the important causes of skin aging. And this is often asked as a MCQ question. So the undergraduates may please note down. So so the MCQ commonly asked is which factors are responsible for skin aging. So in that you have to write UV exposure, and the molecules which are responsible are TNF alpha and interleukin 1. So this TNF alpha and interleukin 1, these are the main pathogenesis behind the skin aging, and this is often asked as a MCQ question. So this is the first factor behind skin aging, that is sun exposure. The second important factor behind the extrinsic aging, that is lifestyle influences, right? So increase in body temperature of around 7 to 8 degrees doubles the evaporative water loss and increases aging. So those of us living in a tropical environment tend to develop aging faster as compared to those living in a more temperate environment. The third important preventable cause of aging is cigarette smoking. So smoking produces aging by two ways. One, it reduces the capillary blood flow, which ultimately leads to nutrient deprivation in the epidermis. And also smoking leads to increase in the matrix metalloproteinase 1, which leads to collagen deprivation. Because of both these factors, the skin aging occurs at a faster rate. And the last important factor is that of effect of pollution. So pollution basically disrupts the stratum corneum, that is the outermost layer of the skin, which leads to barrier dysfunction, and ultimately the process of aging starts. So these are some of the important causes of extrinsic aging. So till now we have discussed the important physiological changes that occur with aging. Now we'll be discussing some of the anatomical changes that occur in the aging process. So basically there are four types of cells in the epidermis. They are the keratinocytes, melanocytes, Langerhans cells, and Merkel cells. So each of them tend to age, and we'll be discussing each one of them. So the keratinocytes, they produce the basic structure of the epidermis. So disruption in the keratinocytes leads to impaired barrier function, which ultimately leads to aging. So what are the anatomical changes that occur in the keratinocytes? So the first important thing that occurs is there is increased fast mediated apoptosis of the keratinocytes. Also with aging, there is decreased proliferation of the keratinocytes, which leads to thinning of the epidermis. So these are the important anatomical changes which occur in the keratinocytes. And because of that, what skin problems occur? So because of damage to the keratinocytes, the barrier function of the skin is affected. Also, there is increase in the transepidermal water loss. Also, because the skin acts as an important barrier for preventing infections, disruption in this barrier leads to increased susceptibility to infections. And also there is increased chances of irritant and allergic reactions in the elderly because of the barrier dysfunction. So these are some of the physiological processes or physiological changes that occur in the skin because of the concomitant anatomical change. So these are the basic defects that occur in the keratinocytes. Keratinocytes, as you know, they produce the basic structure of the skin. The next is melanocytes. So melanocytes, basically they are the pigment producing cells. Disruption in the melanocytes leads to aging process. So with aging, the number of melanocytes tend to decrease, which leads to reduced protection from ultraviolet damage. So as we discussed earlier, UV rays play an important role in skin aging, and melanocytes are the key protectors against the ultraviolet damage. And disruption on these melanocytes or decrease in number of melanocytes leads to reduced protection from ultraviolet damage, and ultimately skin cancers like basal cell carcinoma, squamous cell carcinoma, melanoma, etc. tend to develop with aging. Also with aging, there is damage to the cell membrane of the melanocytes, which leads to dyschromic changes. Dyschromic changes means that there can be both hyperpigmentary and hypopigmentary skin changes. These changes occur because of disruption of the membrane of the melanocytes. So these are the second type of cells. Melanocytes, basically they are the pigment producing cells, and disruption in this type of cells also lead to the aging process. Coming to the third type of cells, that is the Langerhans cells. As you all know, the Langerhans cells are the antigen presenting cells. So what do we mean by antigen presenting cells? They present the antigen to the immune system, right? So they are the first barrier against the external antigen. So with aging, what happens is there is reduction in the number of Langerhans cells, which leads to ultimately increased chances of infections. So these are the changes basically that occur in the epidermis. Now we'll be discussing certain changes which occur in the deeper layer of the skin, that is the dermis. So with aging, there is disappearance in the capillary network, and this capillary network, because of disruption of this capillary network, there is persistence of allergens inside the skin, and also this capillary network plays an important role in thermoregulation, and disappearance of this capillary network leads to impaired thermoregulation. So basically the patient becomes oikulothermatous, which means the external temperature becomes what the body temperature is. So the thermoregulation becomes disrupted due to the disappearance of the capillary network. Also, as we discussed earlier, due to exposure of ultraviolet radiation, there is increased production of matrix metalloproteinases. These matrix metalloproteinases are enzymes which degrade the collagen and elastin fibers. These collagen and elastin fibers are responsible for the elasticity of the skin, and disruption in this collagen and elastin fibers leads to reduced elasticity of the skin. The third important anatomical change which occurs in the dermis is solidification of hyaluronic acid. This hyaluronic acid is very important for its water bearing capacity, and because of solidification of hyaluronic acid, there is reduced water bearing capacity of the skin. And also this hyaluronic acid is important for the suppleness of the skin, and disruption of this hyaluronic acid leads to increased chances of wrinkles. The fourth important anatomical change is reduction in the number of Meissner's corpuscles. As you know, Meissner's corpuscles are important for cutaneous sensation. So with aging, the cutaneous sensation tends to reduce, which ultimately leads to increased risk of diabetic foot, steatotic eczema, etc. Also, there is reduction in the eccrine gland secretion, which also leads to impaired thermoregulation. So these are some of the important changes that occur in the dermis. Also, in the dermis, because of increased production of matrix metalloproteinases, the collagen fibers become fragmented. And because of this fragmentation of the collagen fibers, there is reduced tensile strength of the skin, and also the wound healing process is delayed. And lastly, the subcutaneous fat also gets disrupted with age, and because of which there is increased sensitivity to cold. As you know, subcutaneous fat is a source of insulation for the body, and disruption of the subcutaneous fat leads to increased sensitivity to cold. This photograph demonstrates the schematic representation of the various changes that occur in the skin. So starting from the epidermis, there is epidermal atrophy, dermal atrophy, smoothing of the dermoepidermal junction, reduced vascular tissue, and disorganization and loss of collagen fibers. So this in short is the crux of the talk today. These are the important changes that occur in the skin of the elderly. So I would like to summarize with some important take-home messages. So cross-linking theory, free radical theory, stem cell dysfunction, and telomere shortening are the possible causes of skin aging. Aging occurs as a result of intrinsic and extrinsic factors. Sun exposure and smoking are important causes of aging. Matrix metalloproteinases and tumor necrosis factor are the key mediators of skin changes in the elderly. Epidermal changes in the skin include epidermal thinning, disruption of skin barrier, reduction in the number of keratinocytes, Langerhans cells, and melanocytes. And the dermal changes include breakdown of collagen and elastin fibers, reduced capillary network, reduced mucinous corpuscles, and reduced eccrine sweat glands. I would like to end the talk with a poem by the famous poet Edmund Burke. So this goes as, I look in the mirror and what do I see? A strange looking person that cannot be me. For I am much younger and not nearly so fat as the face in the mirror I am looking at. Oh, where are the mirrors that I used to know, like the ones which were made 30 years ago? Not all things have changed, and I am sure you'll agree, mirrors are not so good as they used to be. So never be concerned if wrinkles appear. For one thing I have learned, which is very clear, should your complexion be less than perfection, it's really the mirror that needs correction. Thank you so much for your patient listening. If there are any questions, you can please ask. So do we have any questions? So I think we do not have any questions. So if we do not have any questions, then I can highlight a couple of MCQs that can be asked for the undergraduates, and then we can end the session. So what are the MCQs that can be asked from this talk? So the first, as we discussed, so what is the function of keratinocytes? So basically that can be asked as an MCQ. The function of keratinocytes is, so your answer should be the keratinocytes produce the basic structure of the skin. The next question that can be asked is, what is the function of melanocytes? So melanocytes, as we discussed, they are the pigment producing cells. So they prevent the damage, ultraviolet damage, and thereby reduce the risk of carcinomas like squamous cell carcinoma, basal cell carcinoma, etc. And the third is Langerhans cells. So Langerhans cells, as we discussed, they are the antigen presenting cells. So the function of Langerhans cells is to prevent infection. So these are the three MCQs that can be asked. Apart from this, they can ask you the important mediators for skin aging. So they may ask you what are the important mediators for skin aging. So the two key mediators that you must remember, that they are tumor necrosis factor alpha and interleukin 1. So these are 3 or 4 MCQ questions that are commonly asked from the presentation that we discussed. Thank you all very much for your patient listening, and I think we end the talk here.